Hello, I'm Julia Walsh from Brand Medicine International, and I'm a search listening expert in healthcare. And I wanted to acknowledge Rare Disease Day 2021 by taking a look at the kinds of search queries that patients with rare diseases are entering into search engines and examining the patient information experience. So for those of you who are not familiar with search listening, I'm just going to quickly take you through a summary of what search listening actually is. So search listening aggregates search queries that have been entered into search engines, and we can read and scrape those search queries around a particular topic. And patients with rare diseases often feel isolated, and it's very unusual that prior to that diagnosis that they might have even ever heard of it. And certainly tracking down groups, people within your friendship group or people in your local community that also have this disease, and being able to kind of consult with them is more difficult when you have a disease that not very many other people are afflicted with. So these patients, more than the rest of us, are more prone to turn to Google and other search engines to get answers to the questions that they have around their disease. And I just wanted to have a little look at how are we turning up as an industry in response to the commonly asked questions. So the reason why this is such a valuable tool in rare diseases and in healthcare generally, but particularly when you're looking for that needle in a haystack patient, that is the patient that is not going to necessarily be easy to find and recruit into a patient focus group, or to find and get them to submit a survey. The place you're going to find questions that they're asking about their disease is when you aggregate the 70,000 queries that are entered into search engines, or Google at least, every single minute around health. This is a great way when you're looking at a data set like that you know that those very rare individuals are actually going to turn up. So the other side of examining the questions that they ask is to look at the patient information experience. So that is the quality of the information that's being served back to them. So I undertook a survey at the end of last year, and many people responded in that survey that they failed to get easy access to answer the questions that they entered into search engines. And many of them came away with more questions that they actually started with after that experience. So for them, I would suggest that the patient information experience is pretty poor. And when I examine that patient journey online as well, I also find very commonly that the information is not really patient friendly, and I guess that makes sense because we're not listening to the questions that they're entering. So how can we have a hope of turning up in the answers? With search listening, though, it does give us a wonderful opportunity to turn up for those patients in a way that we've never had the key to unlock this part of the digital information landscape before. And the metrics that I apply to measure the quality of search results is based on the feedback that I got from patients in my survey and their expectations of what they were looking for in a quality search result. Is it locally relevant to them? So for example, when I worked on Lyrica, because in Australia we don't have access to publish prescription medication information online, those patients were going to the US website, which had different doses and different indications. So, it's really difficult for a patient in one country to understand the context of information that's been published in another country. The results need to be intuitive as well, because for these patients, they are, they've got different kinds of day jobs. They could be bankers or bakers or candlestick makers, but, their health literacy might not be really high. And so making sure that that information is easily understandable for them is really important. So when we do create information that's understandable for patients, we need to make sure that it's searchable. And so when they're asking those questions of search engines, that our results are turning up in those answers. And if we're not turning up that vacuum that we leave as an industry, it leaves room for the bloggers and the clickbait and the misinformation that then spreads through patient groups online like a bad infection. So it's really important that we are present with evidence-based results when patients are asking questions about the disease and even more importantly about the treatments that they're taking. So one other thing that I've layered in here as well, which commonly, because we're in the market of, answering questions, is considering the whole person that's asking that question, considering the mindset of that person when they're sitting there in the middle of the night, unable to sleep because they're trying to get their head around a diagnosis of a disease that they've never heard of before, or a new symptom that seems to have come up and they're wondering what this means. Is it a side effect of the medication? Is it an indication that the disease is progressing? And they're not going to be able to get back to sleep until they feel calmed and reassured about their concern. So turning up with compassion is a really, really important thing. And of course, making sure that the information is new. In the rare diseases space, there's an enormous amount of research going on at the moment. So keeping up to date, and I've gone into search engines and followed commonly asked queries that patients ask about a range of diseases and a range of treatments. And then the top search results are like 15 years old. So that's another thing that's really important in terms of measuring the PICS. So we can give a search result or a PICS experience a score out of 6, and that is something that I look at doing. So I'm just going to toggle out of this and then just go into this one here, where we can have a little look at the real world search queries that have been asked around a range of rare diseases. So this one was acquired lipodystrophy, and one of the wonderful things about search listening is that it gives you an opportunity to get an early read on associations with either a treatment or a disease, where people are asking, is this linked with that, or is this common in this situation? And so, while it might take a long time for these kind of associations to bubble up in a clinical setting, you will see a reflection of early queries around these associations online. Now, I will admit that in terms of these particular rare diseases, I'm not an expert. So I don't know if this is already something that's very common, but people are asking about a relationship between juvenile onset dermatomyositis and acquired lipodystrophy. So if we follow that search result through, you can see that a lot of the answers here, like PubMed, this is a journal, clinical diabetes, and people are like, is it diabetes as well? There's, I think for the average person, these kind of results are going to be hard. They're scholarly articles. I mean, if someone who's, an average level health literacy, they're going to feel quite intimidated by these results. And you know what the experience is like when you're working with specialists in a particular area as well, is that you don't get very regular consultations with them. It costs a lot of money to go and see them. So these patients are really relying on supplementary information from search engines to answer the questions that they, might have. So if we just go along here as well to just having another look here, one of the other questions that often comes up as well is prognosis. Like, here's a very commonly asked question around Aicardi syndrome, and is it fatal? And when I read these questions, I literally get goosebumps, because I think about this poor person who's on the other end of this query, who has entered this in with hope and with fear into a search engine. You can see here, you know, life expectancy. Is it fatal? What is the prognosis? Like, these are all really genuine high concerns that people are asking. You know, and they're going to come to this page, and I can imagine at that point, their blood is just going to go to ice. Like, they're going to be like, oh my gosh, the lifespan is between 8 and 18 years. I would really hope for this patient that this is not the first time that they see this information. So let's have another look at another rare disease, which is Tangier disease. Again, you can see a common theme here where they're looking for prognosis. They're looking for diseases, relationship to atherosclerosis. Again, symptoms, causes. You know, people are often looking for the cause as they move through different stages of grief, of grappling with a disease. They want to look for something to blame because they're in that anger phase. So if we have a look at, you know, what someone who's asking about the prognosis is, they're going to come to this page and they're going to be very relieved to see that this top thing is just going to reassure them right away and say the prognosis is usually good. Whether or not that's true for that individual will depend on their particular circumstances, but that might, at least for the moment, calm them down. I will also just note here these two websites, rarediseases.org and rarediseases.info.nih. It's really wonderful that these are coming up on page 1 of these queries. I imagine that this is a question that is pretty easy to predict, so it's easy to correlate that query to deliver that search result, as well as having a very unusual word that will bring those search results through. What is really wonderful about those websites that I'm sure many industry groups and patient advocacy groups have gone to an enormous amount of effort to create is that they are very comprehensive and very supportive in terms of the quality of the information that's there. So kudos to the industry for, you know, making the move to get these diseases written up here. You've got information for patient organizations, you've got information for clinicians, you've got rare disease advocacy where people can find a group and get involved. And it's a very, very positive experience to stumble across something like this. And it's wonderful that in this particular case, it is turning up on page 1. I am going to just point something else out as well, is that you probably saw a common theme with all of these search results is that this side of the Google search results is empty. No one is placing any advertising here to direct patients asking a particular query into, you know, more patient-friendly, prompting them to follow a pathway into more patient-friendly content that could be published specifically for them. So in this one, of course, these websites did come up, but if we go back to the acquired lipodystrophy and juvenile onset dermatomyositis, you know, there's nothing here really for patients. They're going to get very overwhelmed very quickly, and you could definitely place something here using Google advertising and targeting that to them. So thank you for spending some time with me today to examine the patient information experience online for rare disease patients across a small sample of the many, many rare diseases that are out there. I hope I've been able to illustrate the value of search listening to help us have that opportunity to sit beside the patient who is undertaking that preliminary consultation with Dr. Google, that private consultation that, you know, they're seeking that information, and we can now see what the questions are in their words, and we can see the search results that they're getting, and we can plan as a result of this how we can turn up, how we can improve that patient information experience for them, so that this time next year, when we're reconvening around Rare Diseases 2022, we can look back over the journey that we've made through the next 12 months, and we'll be able to sort of see what a difference we made to make sure that we're correlating our content and patient curated, patient responsive content to make sure that it fits with those queries and turns up for them on page 1 with empathy. And that will allow us as an industry to take an enormous stride towards a more patient-centric response. So thank you very much, everyone, for all your work that you do in the rare diseases space, and onwards.